So, if you decided you're going to learn to speak fluent Mandarin by this coming Monday, you'd fail by Friday afternoon.
Oh, absolutely. I mean, it's literally impossible.
Right. You'd buy the textbooks, maybe download the apps, and just stare at this massive wall of complex characters.
And the sheer crushing weight of that expectation would just completely paralyze you.
Exactly. You'd abandon the flashcards, order takeout, and probably never attempt to learn another language for the rest of your life.
Yeah, the expectation itself is the trap.
It is. Yet, when it comes to men's health, we hand out that exact same kind of, impossible weekend deadline mentality every single day.
We really do.
So today, welcome to the deep dive. We're looking at the official playbook for Men's Health Week 2026 in Ireland. And this campaign does something I have rarely seen in public health messaging.
It's pretty wild, honestly.
It completely abandons the demand for perfection. Like, it gives you explicit permission to be wonderfully, terribly imperfect.
As long as you're just trying to make some kind of progress.
Exactly. Okay, let's unpack this, because the very first thing this planning document does is explicitly validate the feeling of health overload.
Which is huge.
It literally asks the reader, and I'm paraphrasing here, but it says, do you ever get the feeling that everyone is trying to weigh you down with healthy messages?
Yeah, they are acknowledging that modern health advice, as well-intentioned as it might be, has just become profoundly overwhelming for the average person.
It really has. I mean, the document lays out those standard expectations,
Yeah.
and reading them back to back feels like looking at a full-time job description.
Oh, it's exhausting just reading it.
Right. We are told we need to eat 5 to 7 portions of fruit and vegetables every single day.
Uh-huh.
We need to get at least 30 minutes of moderate physical activity on 5 days of the week. Stop smoking immediately. Severely limit alcohol.
And my personal favorite, you need to consistently check your, and I love the terminology they use here, your bits and bobs.
Your bits and bobs, which is just a fantastic phrase.
It's a remarkably clever, disarming way of saying, monitor yourself for early signs of testicular or prostate cancer or other serious diseases.
Right. By demedicalizing the language, they instantly lower the listener's blood pressure.
Exactly. But look at that master list of demands. If a man is currently hitting 0 of those targets, being told he must suddenly achieve all of them simultaneously.
It triggers a classic fight-or-flight response.
Yes. The brain looks at the gap between current reality and this idealized health standard, calculates the massive energy required, and just decides it's safer to do nothing.
Which brings me right back to the Mandarin analogy. When you try to overhaul your entire life in 24 hours, the inevitable failure just becomes a reason to quit entirely.
You wake up, you miss your 30 minutes of cardio, you eat a sausage roll instead of a grapefruit for breakfast.
And your brain immediately says, well, the whole week is a wash. I failed.
Right. I might as well not even try to schedule that doctor's appointment to check my bits and bobs. It is classic all or nothing thinking. Total all or nothing. But the document itself notes that you can't just flip a switch and magically become this hyper-disciplined person.
What's fascinating here is how the strategy for Men's Health Week 2026 engineers a way out of that trap.
How so?
Well, they are actively lowering the stakes. The campaign's entire ethos, which is printed in bold capital letters throughout the text, is to take one step at a time.
One step.
Just one. They are shifting the metric of success away from achieving optimal health and toward just initiating momentum.
It's progress over perfection. They even include a line stating you don't have to stick rigidly to their specific theme for the week.
Yeah, that part is so refreshing.
Right. They say that anything, literally anything that promotes healthier lifestyles, raises awareness of preventable problems, or encourages early detection is welcome.
They really do not care how you participate. You could literally just forward an email.
They just want the needle to move a millimeter in the right direction.
Because medically and psychologically, that millimeter is how sustainable behavioral change actually begins.
That makes sense. When you lower the barrier to entry so drastically, you bypass the brain's resistance to change. If the stated goal is just to take one tiny step, the guy who hasn't seen a doctor in 15 years might look at the mountain of health advice and think,
I'm definitely not giving up my Friday night pints.
exactly. I'm not running a marathon, but I suppose I could make a phone call to the clinic.
But knowing you don't have to be perfect doesn't magically get you off the couch. It just stops you from hating yourself while you sit there.
That's a very fair point.
So how does this campaign actually engineer that first physical step? Because telling someone to take a small step is just another piece of advice unless you provide the tools to actually do it.
Well, they do provide the tools. They've built this frictionless toolkit designed to remove any logistical excuse a person might have for not engaging.
Okay, let's examine that toolkit. They direct people to their website, mhfi.org, where they offer a wealth of entirely free, low-barrier resources.
Yeah, like the Action Man booklet.
Right. The Action Man booklet, which distills health advice down to 10 simple top tips. And they also offer the Men's Health in Numbers Z-Card.
Which, for those who haven't seen one, is a brilliant little piece of design.
It really is. It's an information pamphlet that folds up to the exact size of a credit card, so you can just slide it into your wallet.
It puts hard data directly into a man's pocket without requiring him to carry around, a clinical-looking medical brochure.
It's discreet.
Yeah.
But they also have a massive digital image pack. They provide ready-made social media posts, desktop wallpapers, Facebook cover images, Twitter headers.
Printable posters and badges, too, all just sitting there, free to download.
Yeah. But I have to push back on this strategy for a moment.
Okay, go for it.
I look at a list of digital wallpapers and social media badges, and I wonder, are we just encouraging slacktivism here?
I see what you mean.
Like, does changing your Facebook cover photo to say #progress not perfection actually cure high cholesterol? Does a desktop wallpaper shrink a tumor?
On a purely biological level, no. Obviously, a Twitter header does not affect your cardiovascular system.
Right.
But we have to look at the behavioral science of environmental cues to understand what these digital tools are actually doing. They act as normalization mechanisms.
Normalization mechanisms. Explain the mechanism there. How does a poster lead to a medical outcome?
Think about the environments where men traditionally congregate and how rarely preventative health is a natural topic of conversation in those spaces.
Pretty much ever.
Exactly. The campaign explicitly suggests putting these posters up in pubs, gyms, local shops, betting offices, libraries, and construction sites.
Basically everywhere.
Everywhere. And the digital tools do the exact same thing for online spaces. By flooding the environment with completely effortless, free visuals, they're applying the mere exposure effect.
Oh, the psychological concept that people develop a preference for things merely because they're familiar with them.
Precisely. That concept applied to public health. If you see a Men's Health Week poster while ordering a drink at the pub, and then you log into work and see the campaign logo on your colleague's desktop wallpaper, and then your local sports club posts the hashtag.
The topic loses its taboo status.
Yes. Talking about that nagging pain in your knee or your feeling of chronic fatigue is no longer a scary, isolated admission of weakness. It's just a normal part of the cultural environment.
It's infiltrating their daily life without ever asking them to step foot inside a hospital. It warms up the room, essentially.
It breaks the ice for the ultimate call to action. The document is very clear about the core directive, which is during MHW 2026, get to know your numbers, because men's health counts.
Get to know your numbers.
Right. You cannot convince a man to go get his blood pressure or cholesterol numbers checked if he is too intimidated to even acknowledge the concept of health.
So the desktop wallpapers and Z-cards are the icebreakers that make the clinical visit possible.
Exactly.
Okay, so they've lowered the expectation and they've normalized the conversation using these environmental cues.
Yeah.
Here's where it gets really interesting, though, because making a progressive lifestyle change is still incredibly difficult if you are the only one in your environment doing it.
Oh, absolutely.
Like if you are trying to cut back on drinking, but your entire social circle centers around the pub,
Yeah.
your individual willpower is going to deplete very quickly.
Willpower is a finite resource. If a health campaign relies solely on an individual's willpower to succeed, it will fail at a population level.
Every time.
And that brings us to the most robust part of this source material, the societal ecosystem they've designed.
Yeah, the document does not just look at the individual man and say, go fix yourself. It outlines specific, manageable actions for almost every facet of society.
It distributes the burden of health.
Instead of reading through the list like a table of contents, let's look at how these different groups actually function to remove friction. Let's start with employers.
Well, the modern workplace is arguably the biggest structural barrier to men's health.
Eight.
The most common excuse for missing a doctor's appointment or skipping a workout is a lack of time due to work commitments. So the campaign targets the employer directly.
They suggest organizing health checks on site. or setting up a pre-work football game.
Yes.
But the suggestion that blew my mind was asking employers to explicitly offer their staff an hour off work to attend a Men's Health Week event or to actively support a walk-to-work week.
It's brilliant. Think about how that shifts the locus of control.
You no longer have to burn your limited willpower sneaking away from your desk, worrying about falling behind on emails just to take care of your body.
Exactly. Your boss is actively sponsoring that hour. The friction of time is completely removed. If we connect this to the bigger picture, we can think about this entire societal approach like drafting in a bicycle race.
Drafting. Like when cyclists ride in a tight pack, a peloton, to conserve energy.
Yes, the lead rider hits the wind resistance head-on, taking the brunt of the aerodynamic drag. And the riders tucked in behind them can maintain the exact same speed while expending up to 30% less energy.
Wow, 30%.
Yeah. For decades, traditional health messaging has told men they need to ride alone, headfirst into a hurricane of structural, social, and psychological barriers.
It requires a Herculean amount of pedaling just to not go backward.
But this campaign is building a peloton around the individual man. The employer is riding out front, breaking the wind resistance of time constraints by giving them an hour off.
That is a great analogy. So who else is in this peloton?
Sporting bodies play a massive role. The document highlights that many men already have a deep cultural and emotional connection to sports.
So the campaign leverages that existing infrastructure.
Exactly. They suggest printing health messages directly on players' shirts, inserting health statistics into match day programs.
Or having a respected local athlete deliver a health talk after a training session.
Right. Or setting up a park run, or developing walking football leagues so older men can stay involved.
So the sports club breaks the wind resistance of motivation and social isolation. You aren't forcing yourself to jog alone in the dark.
No, you're just showing up to see your mates at the club, and the physical activity happens as a byproduct.
The drafting effect extends all the way to the legislative level too, doesn't it? The document specifically calls on politicians and policymakers.
It does.
It suggests they table debates on men's health in Dáil Éireann, which is the national parliament in the Republic of Ireland,
Right.
or in Stormont, the Northern Ireland Assembly, or even just in local county councils.
They propose creating inter-party working groups or adopting elements of the Healthy Ireland Men Action Plan across borders.
By embedding men's health into the very laws and policies of the land, the politicians are breaking the wind resistance of systemic neglect.
They are securing funding, creating public health infrastructure, and ensuring that when a man does decide to take that first step, there is a clinic open and staffed to receive him.
And we can't ignore the role of families, specifically the women in these men's lives. The document speaks directly to partners, mothers, sisters, and daughters.
They are often the most vital riders in the peloton.
Why is that?
Well, research consistently shows that men are notoriously bad at self-reporting symptoms.
Oh, for sure. We ignore everything.
The document asks women to provide that trusted nudge, to encourage their partners or sons to finally go see a GP about that niggling health concern that they've been ignoring for 6 months.
And again, if you are listening to this and thinking, well, I don't own a business, I'm not a politician in the Dáil, I don't manage a sports team.
Right.
The beauty of this campaign is that you can still pull your weight in the peloton with zero resources.
The document provides solutions that require absolutely no money and barely any time.
If you are part of a community group, you can get a local gym to offer a free day pass, or you can start a healthy eating cookery class. But even if you have nothing but a smartphone, you can forward an email. You can add the Men's Health Week logo to your email signature for the month of June.
You can print out one free poster and stick it on the notice board at your church hall.
Or your local men's shed, or even just in the waiting room of a local business.
Every single one of those microscopic actions reduces the aerodynamic drag for someone else.
It really does.
When a man is surrounded by a workplace that gives him time, a sports club that normalizes the conversation, a government that funds the clinics, and a family that encourages the visit.
Taking that one small step towards better health suddenly requires very little individual willpower.
The environment does the heavy lifting, the community breaks the wind so the individual can finally move forward.
And that completely recontextualizes what progress over perfection actually means in practice.
How so?
Perfection is the arrogant belief that you can and must conquer the wind resistance all by yourself. Progress is having the humility to tuck into the peloton, utilize the support systems around you, and just pedal a little bit consistently.
That's a perfect way to put it.
So what does this all mean for you listening right now? The takeaway from the Men's Health Week 2026 playbook is a blueprint for escaping the trap of overwhelming expectations.
Yeah, it proves that improving health isn't about white-knuckling your way through a grueling, miserable fitness regime while fueled by shame.
It is about leveraging your environment. Whether you are a business owner who can carve out an hour of paid time off for your team, a sister who can ask about a persistent cough,
Or just an individual who can download a free PDF and read 10 basic tips.
you have a position in this peloton. You drop the paralyzing demand for perfection, you find out what your health numbers actually are, and you take one tiny, sustainable step forward.
And, this raises an important question, one that extends far beyond physical health.
Oh.
If a society can successfully mobilize employers, media, local sports teams, and national politicians just to help people take one small step toward a medical checkup,
Yeah.
what other seemingly insurmountable challenges in your own life are you currently trying to fight alone?
Oh.
If you stopped trying to learn the whole language in a weekend, if you stopped demanding absolute perfection from yourself, and instead focus entirely on drafting behind your community to take just the very next step, what could you actually achieve?
A brilliant reframe. Really something to think about the next time you feel paralyzed by the pressure of getting it all exactly right. Thanks for joining us on this deep dive. We'll catch you next time.